If you are over 60 and you find yourself waking up 2, 3, or even 4 times a night to urinate, you are not alone. Nocturia is one of the most common complaints among seniors, and it can quietly steal your sleep, your energy, and even your confidence. Many people assume it is simply a normal part of aging, something you just have to accept. But while aging does change how the bladder and kidneys function, there are natural ways to support your body. One of the most powerful and often overlooked strategies starts right in your kitchen. Before we talk about the fruits, it is important to understand what nocturia really is. During the day, your kidneys filter waste and excess fluids from your blood, producing urine that is stored in the bladder. At night, the body is supposed to reduce urine production so you can sleep for longer stretches. However, as we age, hormonal signals that control urine production can weaken. The bladder muscles may also become more sensitive or less elastic. In men, prostate enlargement can play a role. In women, hormonal changes after menopause can affect bladder control. The result is frequent nighttime trips to the bathroom. Now, here's the encouraging part. Certain fruits contain nutrients that can help regulate fluid balance, reduce inflammation, support bladder health, and stabilize blood sugar. All of these factors influence how often you wake up at night. The first powerful fruit is the pomegranate. This deep red fruit has been studied for its impressive antioxidant content. Pomegranate is rich in polyphenols, which help reduce inflammation throughout the body. Inflammation can irritate the bladder lining and increase urgency, especially at night. By supporting a healthier inflammatory balance, pomegranate may help calm bladder overactivity. It is also beneficial for cardiovascular health. Improved circulation supports kidney function and helps the body manage fluids more efficiently. Some research also suggests that pomegranate may support prostate health in men, which is particularly relevant because an enlarged prostate is a common contributor to nocturia. A small glass of fresh pomegranate juice earlier in the day or a bowl of the seeds as part of lunch can be a gentle way to incorporate it into your routine. The second fruit is banana. Many people do not immediately associate bananas with bladder health, but they play a powerful role in fluid regulation. Bananas are rich in potassium, a mineral that helps balance sodium levels in the body. When sodium intake is high, the body tends to retain water during the day and then release it at night, leading to increased urine production while you sleep. Potassium helps counteract this effect by promoting healthier fluid distribution. Bananas also contain magnesium, which supports muscle relaxation. The bladder is a muscular organ, and proper muscle function is essential for normal control. In addition, magnesium can improve sleep quality, making it easier to fall back asleep if you do wake up. Eating a banana in the afternoon rather than right before bed may help you gain the benefits without adding extra fluid volume late at night. The third fruit is apple. Apples are often described as simple and ordinary, but their benefits are anything but ordinary. Apples contain soluble fiber, particularly pectin, which helps stabilize blood sugar levels. Why does blood sugar matter when we are talking about nocturia? Because when blood sugar rises too high, the kidneys work harder to eliminate excess glucose through urine. This process pulls water with it, increasing urine production. For seniors with insulin resistance or type 2 diabetes, nighttime urination can be closely linked to blood sugar fluctuations. By helping maintain more stable glucose levels, apples may indirectly reduce nighttime urine output. Apples also contain quercetin, a plant compound with anti-inflammatory properties that may soothe urinary tract tissues. Choosing a whole apple rather than juice provides more fiber and a slower, steadier effect on blood sugar. It is important to remember that timing matters. Drinking large amounts of fruit juice late in the evening can increase fluid intake and worsen nocturia. The goal is not to overload the bladder before bedtime, but to nourish the body earlier in the day so that nighttime urine production naturally decreases. Ideally, these fruits should be consumed in the morning or early afternoon. Beyond fruit, there are additional habits that work together with nutrition. Reducing caffeine and alcohol intake, especially in the evening, can significantly lower nighttime awakenings. Monitoring salt intake is crucial because excess sodium encourages fluid shifts that often show up at night. Gentle pelvic floor exercises can strengthen the muscles that control urination. Maintaining a healthy weight reduces pressure on the bladder. And managing chronic conditions such as hypertension and diabetes is essential for long-term improvement. It is also wise to speak with a healthcare professional if nocturia is severe or sudden. In some cases, it can signal underlying conditions such as sleep apnea, heart issues, urinary tract infections, or poorly controlled diabetes. Natural strategies are supportive, but they work best when combined with proper medical guidance. Sleep is not a luxury, it is a biological necessity. Deep, uninterrupted sleep supports memory, immune function, emotional balance, and cardiovascular health. When nocturia repeatedly disrupts your sleep cycle, the consequences can extend far beyond fatigue. Poor sleep increases the risk of falls, affects concentration, and may even influence long-term cognitive health. The encouraging message is that small, consistent changes can create meaningful results. Adding pomegranate for its anti-inflammatory and prostate-supportive properties, incorporating banana for potassium and muscle support, and enjoying apple for blood sugar stability can form part of a practical, natural approach. These fruits are not magic cures, but they provide the body with tools it needs to function more efficiently. Aging does not mean surrendering to discomfort. It means adapting wisely and supporting your body with smarter choices. If you are waking up several times a night, consider looking at your plate as well as your habits. Sometimes the solution begins with something as simple as a piece of fruit. With patience, balanced nutrition, and healthy lifestyle adjustments, many seniors find that their nighttime bathroom trips become less frequent and their sleep becomes deeper. And when sleep improves, everything else often improves with it.